Hi guys, so today we're going to talk about signs of PMS if you're PMSing and what to do about it. First of all, PMS stands for Premenstrual Syndrome. Premenstrual, so it happens right before you get your period. And premenstrual dysphoric disorder, or PMDD, is when your symptoms or PMS are so bad they're affecting your quality of life, like you're getting fired, breaking up with your boyfriend, or getting a divorce, or you're having problems in your personal life because of how bad your symptoms are. PMS and PMDD happen 1 to 2 weeks before you get your period. And once you get your period, the symptoms go away. It's cyclic. It happens every time right before your period. You don't skip months where you don't have the symptoms. So if you're skipping months, or if your symptoms don't go away when you get your period, then you might be having something else, and we'll talk about that. 75% of women will have PMS, but only 3 to 8% of women will have PMDD, which is the severe form of PMS. So it's much more common to have PMS symptoms. Those very common is not really a problem. But when you have the PMDD, that's when you want to have treatment. So what causes PMS? We really don't know. It's thought that the fluctuations or the going up and down of the hormones during your normal menstrual cycle might trigger these symptoms. And also some women are just more sensitive to these changes in hormones throughout the month. The symptoms of PMS and PMDD: women feel very sad, very nervous. It causes you to have problems, difficulty concentrating. The very common ones are feeling angry. Everything irritates you, a lot of tension. You feel very tense, and it causes problems in your daily activities. Fatigue, bloating, anxiety, feeling sad or hopeless and feeling worthless, having just mood swings, just feeling very happy and then all of a sudden you feel very depressed, and you become very tearful, feeling very edgy. You have conflict with family, coworkers, and friends. Decreased interest in the stuff that you usually have a lot of interest in. Maybe you stop enjoying the things that you usually like to do. Difficulty concentrating, feeling no energy, or feeling fatigued and tired. Change in your appetite, either you binge, you eat like crazy, or maybe you're craving certain foods that you don't usually crave. Excessive sleeping, or even difficulty sleeping and insomnia, feeling overwhelmed, or you feel like you're out of control. And sometimes some women feel breast tenderness or swelling, or headaches, joint pain, and waking. The very most common ones are feeling angry, irritable, internal tension, moody, bloating, anxiety, stuff like that. A lot of the symptoms of PMS are also symptoms of anxiety or depression. So it's very important not to confuse PMS with depression or anxiety, because depression, of course, can have suicidal tendencies, and it can be very harmful if you have that. It's important to go see your doctor if these are problems that you're having, so that you can get diagnosed. Women with depression or with anxiety, when they get their period, their symptoms don't go away. So that's the key. When you have PMS, the symptoms are usually 1 or 2 weeks before you get your period. It's not the whole month. So how can you tell if you have PMS or PMDD? Well, the diagnosis, there's really no single test out there, so you really have to go see your doctor. A lot of times your doctor will have you keep a calendar, like 2 full menstrual calendars, where you write down your symptoms and how severe they were every day and how it affected your personal life. And in that way, you can get diagnosed with PMS or PMDD. A lot of times you don't really need blood tests, but since a lot of these symptoms of depression, anxiety, and fatigue can be also due to thyroid problems, your doctor might want to check your thyroid level, hormone levels, or they might even want to check to see if you have anemia, and maybe that's why you're so fatigued and so sleepy. So the first line treatment for PMS, PMDD is to exercise regularly. Exercise really will get your mood up and make you more stable. You can also do a lot of relaxation techniques like meditation, doing hypnosis, muscle relaxation. Some women do acupuncture, and vitamin supplementation or mineral supplementation, like taking a daily multivitamin. But in particular for PMS, vitamin B6 is very useful. And second line treatment, or once you maybe these more conservative treatments haven't really helped you, then your doctor might want to start you on medication, is used to treat PMS, or SSRIs. It's a type of antidepressant. The more common ones are Prozac, Zarafem, Zoloft, Celexa, and Paxil. These, of course, if you're allergic to these, you shouldn't be taking these. They have side effects, so only your doctor can tell you what you should be on. A lot of times you'll just have to take them during the 2 weeks before your period when you're having the symptoms, but you should at least take them for a couple, 2-3 months to see if they're working. Don't give up after the first month. It takes a while before they start working. A common side effect of these is inability to have an orgasm or decreased ability to have an orgasm. So if that happens to you, your doctor can either switch you to another medication or lower your dose. And other antidepressants are Effexor and Lexapro also that you might want to consider. And of course, a great way to regulate your hormones is to go on a birth control method. It can either be the pill or the NuvaRing or any hormonal birth control with estrogen, progesterone will help you regulate your hormones. In particular, there's a pill that was approved by the FDA for PMS, PMDD. It's called YAS. It's been found though that this has a higher risk of blood clots, but it's still a very low risk. But if it's something that you might want to bring up to your doctor to see if it's a good option for you. Stuff that doesn't work is lithium, maybe other antidepressants, primrose oil, ginkgo biloba. Definitely try out exercise, meditation techniques, stuff like that will help you feel better. So I hope this helps you guys. Like the video, subscribe to our YouTube channel, like us on Facebook, and email me any questions at gynogal@gmail.com. See you next week. I get a lot of emails or texts from friends or you guys asking me how you know if you're pregnant. Well, the easiest thing is just go get a pregnancy test. But I know a lot of times that's not easy to do, or you're not ready to go check a test yet. First of all, if you are sexually active and if you're not using birth control,